government has implemented a number of restrictions to try curb the spread of the coronavirus and reduce the burden on the country's healthcare system.
That's right. This includes curfews and bans on alcohol sales. This, as a study has found, that alcohol bans are actually correlated with a significant drop in unnatural deaths. Let's make sense of this research now. Bring in Director of the Southern African Alcohol Policy Alliance in South Africa. That's Maurice Smithers, who joins us now via our video link. Maurice, great to see you. Thanks very much indeed for making time to chat to us. Let's begin here. This study, is it showing us a correlation or a causation between the alcohol ban and a drop in unnatural deaths?
Look, I think it's both, actually. I mean, the fact is that if you look at the study that has been done by the SAMRC, it's showing that in the periods when there was a complete ban, there was a dramatic drop between 26 and 49% in the number of expected unnatural deaths in the country. So it shows that there's a direct correlation between the complete restriction on alcohol and the drop in unnatural deaths, which is deaths caused by things like car crashes, suicides, interpersonal violence, and so on. The one interesting thing about the study, though, which they call an anomaly, but we would disagree with that, is that in that period of the 1st of June to the 11th of July, there is also a drop. It's not as significant, it's 13%, but there is definitely a drop in unnatural deaths. And that's the only period that wasn't a complete ban where on-consumption alcohol was banned, but off-consumption was allowed. All the other periods when there was no ban, there was either no restrictions or there was a ban on off-consumption sales. So that proves a point that we've been arguing for some time, that if government wants to restrict alcohol but not go for a complete ban, then the best thing to do is to ban on-consumption, because on-consumption is where the virus can spread. On-consumption leads more to the incidence of interpersonal violence and car crashes.
Right. We will speak to what this might mean perhaps in the long term, because there's definitely something to say around perhaps what we think about policy direction. But as a start, is this actually new information? I mean, the argument had always been that if you ban alcohol sales, there'll be a drop in trauma-related cases in hospitals, for instance, and that's because there's less trauma actually taking place in society, so to speak. How much of a game changer really are the findings from the study?
No, well, I think that's the point, is that it is saying that alcohol, unfortunately, is related to trauma, to a lot of trauma cases, and particularly over periods like weekends, when there is an increase in car crashes, an increase in interpersonal violence, and to an extent self-inflicted injuries, unintentional injuries. So there's a very definite link. What it's showing is a very definite link between how we use alcohol and its contribution to trauma cases in our society. So it definitely has implications for the future, because while right now we should be focusing on how we deal with COVID, we definitely need to look into the future and say, what have we learned from COVID about how we can actually make our country a safer country in relation to the use of alcohol going forward. And if it's quite clear that alcohol is directly related to an increase in trauma cases, then we need to say, well, how are we going to reduce that?
Right.
And our argument is that you introduce better legislation which complies with the World Health Organization, which says reduce the availability of alcohol, increase the price of alcohol, and limit or ban advertising. Because those three steps together will create a culture in which people drink less excessively and more safely, and therefore are less likely to get involved in actions or activities that are going to lead to trauma cases.
A lot to think about. Maurice Smithers, let me thank you for your time for now. Thanks very much indeed for chatting to us. He's the Director of the Southern African Alcohol Policy Alliance. Once again, thanks very much indeed.